Good morning. My name is Karan Patel, and I'm a first year medical student at Cooper Medical School, Rowan University. One of my primary research interests include assessing physician burnout and figuring out ways to combat burnout. My project focused on the difference in burnout rates between surgical and non surgical specialties within medicine. Before I can continue, I must first define what burnout is so that we're all on the same page. Burnout is defined as a state of emotional, physical, and mental exhaustion caused by excessive or prolonged stress. There are three major domains to assessing burnout, which include depersonalization, emotional exhaustion, and lack of personal achievement. The most important factors when it comes to physician burnout would be the first two, depersonalization and emotional exhaustion, and these are the primary factors considered in most of the studies that we looked at. Physicians have higher burnout rates than the general population. The average burnout rate for a physician hovers around 49%, compared to 28% for someone in the general population. However, not all specialties within medicine have the same rates of burnout. While looking at data, our team noticed that surgical specialties seem to have higher rates of burnout than non surgical ones. For example, if we look at Medscape's annual burnout and depression surveys from 2018, we can see that out of the top 10 most burnt out specialties, only two of them are surgical in nature: OB/GYN and urology. We want to determine if this empirical observation could be backed by data. As a result, we got all of the data from the burnout and depression surveys from 2017 to 2020 and tried to determine burnout rates between surgeons and non surgeons. Similar to the slide presented before, our data was broken up into categories: burnout in non surgeons and burnout among surgeons. We then found the average rate of burnout between these two from 2017 to 2020 and compiled an overall percentage for each of their rates of burnout. Afterwards, we determined what factors caused higher rates of burnout, and we looked at prominent surveys, including those by the American Medical Association, Doximity, and the Physician Foundation, to understand each specialty. Moreover, we performed a literature review using searches from Google Scholar and PubMed with keywords including surgical burnout, non surgical burnout, electronic health record, and compensation to further help us determine what factors were most correlated with physician burnout. Here are results. As you can see by the first graph, although the burnout rates among surgeons and non surgeons varied by year, surgeons consistently had lower rates of burnout than their non surgical counterparts from 2017 to 2020. In this next graph, we compiled all the data from the previous graph, and we found that the average surgical burnout rate was 44.68% compared to 49.35% for non surgical burnout. The p-value was 0.05, and the odds ratio was 1.25, with a 95% confidence interval between 1.1 and 1.3. So we want to determine exactly what factors were most associated with burnout. And what we found from our literature review was that increased charting and paperwork and slash use of the electronic health record, insufficient monetary compensation, and lack of respect from patients were the primary reasons why there were higher burnout rates among non-surgical specialties than surgical ones. When we compare the time spent on the electronic health record, we found that on average per week, surgical specialties spend around 23.7 hours compared to 31.5 for non-surgical specialties. Surgical specialties also spend less time on administrative tasks, averaging around 2.1 hours per week compared to 3.5 for their non-surgical counterparts. Moreover, surgical specialties tend to end up having a higher compensation by almost $70,000 per year, $407,000 for surgical specialties compared to $334,000 for non-surgical ones. In order to help decrease physician burnout, we suggest two things. One is to increase the use of scribes in medical practice, and two is to increase face-to-face bedside rounds. Initially, the suggestion of increased scribes in medical practice may come with some hesitancy, since they will have higher upfront cost. However, a 2018 paper published in JAMA Dermatology showed that increased scribes actually led to decreased physician burnout and led to an increase in fourth quarter revenue at the clinic because physicians were willing to take on extra patients. In addition, we suggest implementing more face-to-face interactions with the patient. Much of medicine today has been revolutionized by technology. More than ever, doctors are spending an increased time in front of computers and are treating the data and not so much treating the patient. The patient misses all of the care that goes on behind the scenes and as a result may think that their doctor is not spending an appropriate amount of time diagnosing and treating their condition. Having more face-to-face interactions may allow the patient to see the care that goes on in their treatment, and as a result, they may be more appreciative of the physician. That concludes my presentation. Thank you so much.